deja vu because you tried to sell us saving a healthier future. This thinks is sliced bread. Now you're trying to sell us STPs. Now, why don't you have a proper consultation? Now, because we didn't have a proper one in the first place. Now, I was at a council meeting with Stephen Cowan months ago, and you were there, Dr. Spicer, and so were you, Tracy, and you were asked for a business plan. Have you provided that yet?
So the business plan.
You were asked to come back to a meeting later and provide a business plan?
As Stephen said a little earlier, the business plan for shaping healthy.
Yeah, where is it?
Not complete.
Well, when is it going to be in place?
Is.
It never is, you see. We ask and we ask and we ask, and you just like saving a healthy future was supposed to be the best thing for us, now STP is again the best thing for us. We all know it's not. So why don't you provide something better? A new consultation, a proper consultation, because we didn't have one, and the business plan. Why won't you provide the business plan? Where is it? How long more is it going to take?
So the business case is purely a request for capital. It has no more. It is not supposed to be sitting there to provide lots of detail about the clinical models and the different services. We've had some discussions about those in other places. We have released information on those kinds of information. That is not the purpose of this business case. It is purely a financial business case to the Treasury saying this is the capital we need to implement Shaping a Healthier Future. And we were expecting to release that in September, but because of the STP process, we were asked to make sure that that reconciled and to understand how capital for Shaping a Healthier Future and other capital requirements for the STP came together. So we are still doing that work, and we absolutely want to get that out into the public domain because we recognise that we are all frustrated, us included, about the fact that that hasn't helped so far.
So Claire, I think this is important to actually acknowledge that the public generally was told year after year that there was going to be an implementation business case and that it wasn't. It was never said until the last few weeks that this was limited to capital expenditure. So when do we see a business case for the full implementation?
Mr. Hunt decides what he wants to do.
So what's the
Right, excuse me, some of us have got our hands up.
Yeah, and so I have said, this was the last question, I was going to take as a group, and then we're going to do this individually because we
How
haven't
many
got
are going to
so.
get it then? So when can we see it?
So there is not an intention to produce a single business case
So
for
we're not
all
going
of
to
the
get
services within Shaping a Healthier Future.
So
What
we're
there
never going
is
to
an
get it then?
intention is for individual service changes, as we do them, and to be sharing the evidence base behind it, what we're trying to do, because we don't. If you look, and again, I recognise this is unpopular, but for those who've been in Ealing or seen any of the Ealing work around paediatrics and maternity, there is a significant amount of work involved in making any of those changes, and we did a lot of work with patients, with residents, with clinicians to say what is the model of care we need, how do we get the best outcomes, and
What
how
about
do
the
we deliver
consultation?
that.
Why don't you have a proper one? We didn't have one. So why don't you have another one? Why
So-
don't you have a proper one? You've asked for something else. Why
So I think that we would recognise that since the formal consultation that was done, there hasn't been as much engagement meeting the needs of people in the room as people would like to have seen, and I think that we would recognise we have tried to engage better more recently, recognising there are still more questions, but we have tried to work more closely with the Save Our Hospitals campaign than we have done previously. So there are still things we can do better. We believe the plans we have in place are the best plans to deliver the best health outcomes for our population.
But you don't believe that.
Within the financial constraints. Why aren't you opposing that? Because as you said to us outside the meeting, that the amount of GDP spent on health in this country is low by any measure.
Our responsibility is not to comment on anybody's political policies or government policy. Our responsibility
Is a political decision, whether you like it or not.
You have a professional duty to defend the health of residents locally, and keeping quiet about it and saying we'll make the best of a bad job is not good enough.
We have a responsibility to meet the needs of the population information within the budget which is allocated to us, and Shaping a Healthier Future was clinically based plans. The things we are trying to do are things we would, even if we had more money, most of the things we are trying to do are things we would want to do anyway because we believe they are in the best interest of patients. I don't know whether one of my medical colleagues would want to comment on that.